Hello friends, in this video I'm going to talk about 7 important facts about Bell's palsy that very few people talk about on the internet. These facts are going to be backed by the personal experience of working with 1000+ people suffering from Bell's palsy and synkinesis, at the same time some clinical evidences that we have found on our research while working on Bell's palsy and synkinesis. Hi friends, I am Physio Meghna Dave, founder and CEO of Healthcare Rehab and a neuro-rehabilitation physiotherapist with 15+ years of experience in space of neuro-rehabilitation and expertise very specifically in the area of Bell's palsy and synkinesis recovery. Let's get started with today's video. Friends, Bell's palsy recovery is not just a straight line linear process. It comes with lots of ups and downs. People can recover within few days, like 1 or 2, few weeks, and sometimes it might take more than 1 year for people to recover. And everybody just tend to get into this loop of misinformation and wrong guidance from other people who have suffered from similar experience, but their journey is not the same. That's why they feel left alone, left out, and clueless about what is the right path of recovery of Bell's palsy. The intention of creating these videos on our channel is to give you a better understanding of what Bell's palsy is all about and how this recovery takes place. This video is also an attempt to do that. Now let's start with the 7 facts that you should definitely know about Bell's palsy recovery. In that, the first fact you should know is every patient is different. It's not necessary that if one patient recovers in 3 days or 1 week, you will too. It totally depends on few factors. Number 1, what is the cause of your Bell's palsy? Was it an inflammatory lesion? Was it an infectious lesion? Or else it was a compression due to which you got facial paralysis. Every pathology will have an impact and will determine the timeline of your recovery. For example, people who suffer from Lyme disease or Ramsay syndrome usually takes longer to recover compared to an inflammatory kind of Bell's palsy. Along with that, people who have poor immunity, they also tend to take longer time to recover. People who have got conditions like diabetes mellitus or else some pre-existing health issues, they also find it difficult to recover. Women who are pregnant and develop Bell's palsy during their pregnancy might have better recoveries because there it's more of a compression based Bell's palsy or is an inflammation based Bell's palsy. But again, that's not the necessity. If it is coming from an infectious lesion, then it might take longer. So please don't think or compare that if one person recovered from Bell's palsy within 7 days, you will recover too. This varies from individual to individual. However, the good news is that majority of people, 95 to 98% of people who suffer from Bell's palsy recover out of it 100%. Having said that the right steps are taken at right time. Second fact that you should know about Bell's palsy is your eye is at highest risk of infection and impairments apart from anything else on the face. So the first duty of yours during your Bell's palsy recovery is to protect and take care of your eyes. And the first and the most important thing you should do about it is make sure to minimize your screen time as much as possible. The more you expose your eyes to the blue lights or the screens, the lesser the blink speed is going to be there on your eyes, which is going to make your eye feel more dry, itchy, and will increase the watering of the eyes. When you are in the later stages of Bell's palsy, let's say you have synkinesis, in that case, you will observe the more time you spend in front of screens, your eyes will get more smaller and smaller. Hence, it's very important for you to keep a watch on your screen time as much as possible. And let's say if you have an occupation where you are forced to sit in front of screens for long hours, then make sure that you protect your eyes with a tinted glasses so that the strain of that white light that's falling on your eyes is minimized. Please remember this fact and don't ignore it. Let's move on to fact number 3. The rehabilitation process has to go in a step-by-step fashion. One exercise that is suitable in the initial phase of Bell's palsy will not work in the middle or in the later stage of Bell's palsy. Exercises needs to be changed. At the same time, care plays a very critical role in your recovery process, and the rehabilitation or recovery protocol that you are working on should be holistic in nature. It should not just focus on exercises or massages. You have to combine your recovery practices with the right diet, with the right mindset and the mental health practices, right sleep hygiene, at the same time the right therapeutic protocol in order to get the best outcome. Hence, a multimodality approach is far more effective when it comes to Bell's palsy recovery versus just following a single therapy model. Next is, always remember, Bell's palsy will either happen due to an infection or compression on the facial nerve. This facial nerve lies inside your ear, to be very specific, in the middle ear region. Hence, your healing has to happen here in the middle ear. Working on the face is not going to heal your Bell's palsy. I don't mean here by saying that you should not work on your face. You have to work on your facial muscles. But facial muscle movements are the outcome of the healing and not healing itself. The healing has to happen on internal ear. This healing is dependent on three most important factors. Number one, your medication. Please don't miss out on your medication. Don't even think that if I don't take medication, Bell's palsy will recover on its own. Please don't make this mistake. The moment you develop Bell's palsy, please go and visit a doctor and take your medication on time. Second thing is your diet. Make sure to invest in a good nutritionist who can help you to come up with the right anti-inflammatory diet that will minimize the inflammation levels from your body and will help your body and aid your body to heal. Third is your mental well-being. Your facial muscles are also the muscles of expression and emotions. If you are feeling tensed all the time, if you're feeling sad all the time, if you are constantly thinking about this condition and being in that negative zone, it's going to pull your facial muscles further down because somewhere it is connected to your emotional center. So, working on your mindset is equally important and crucial. If you feel that your emotions are not under control, it's going beyond your control, please don't hesitate from taking a help from a mental health specialist. This is going to be a game changer when it comes to your recovery process. The fifth thing is, massages are far more crucial than facial exercises at any stage of Bell's palsy. Now, when I say this, I don't mean at all that facial exercises are not important. Yes, they are absolutely, but facial massages are equally and more important when it comes to Bell's palsy. However, these facial massages are not the random facial massage that you can get it done on any of the parlors or just anybody can randomly do it. It has to follow an anatomical pattern that will ensure that your muscles are taken at its right position and we attain a maximal corrected position of the face. Have a look at this diagram. For your face to be in this position, the facial muscles also have to be in this neutral position, isn't it? Now, to do that, we need to take help of facial massages to make these facial muscles go to that position which gives a neutral resting posture to your face. When you have Bell's palsy or its synkinesis, this resting posture of your facial muscles is disrupted. And please remember, your facial muscles are directly connected to the skin. They are not connected to the bone. That's the unique property of facial muscles. They start from the bone, but they end at a skin level. That's why wherever you take your skin, your facial muscles will follow. And that's the reason massages are great practices when it comes to Bell's palsy rehabilitation. But please remember, wrong massage can do all the harm. I see a lot of patients making this mistake of stretching the lower eyelids in downward direction. That lapses or increases the laxity of your eyelid muscle, which is already paralyzed and weak. So make sure that don't make these kind of mistake. Take professional help, learn the practices in the right way, and then only do the facial massages. Sixth is about facial exercises. Facial exercises are going to retrain your facial muscles to move in the right pattern in that right direction. That's why these facial exercises has to be expression based and not movement based, and has to be guided in the right direction, in the right frequency, at a right intensity. That's why facial exercises in acute phase of Bell's palsy will be different. Facial exercises in the subacute phase of Bell's palsy will be different, and the exercises that needs to be done in synkinesis level is going to be different. It cannot be made one size fit all approach, and that's where again working with a specialist is important. What is the kind of facial exercises that we do? It depends on which muscles are involved, what is the strength level of that muscle, and based on that, the amount of loading that is placed on these muscles, how these exercises have to be done is totally determined. So remember, facial exercises is to retrain your facial movements and not for healing. Now let's move on to the seventh tip or seventh fact about Bell's palsy, and that is there are two and only two exercises that you should do every 2 hours. Apart from that, not much of exercises needs to be done throughout the day, and both exercises are related to your eyes, especially when it comes to acute phase of Bell's palsy. Since your eyes are not moving, the blink is not happening in the right way. As the blink is not happening in the right way, we need to artificially blink to train or else to maintain the muscle memory of how the blink happens. That's where artificial blinking is the exercise that you should do every 2 hours. How do you do that? Place your thumb below your eyelid, place the index finger above your eyelid, and then close the eyes, open the eyes. Repeat this process 3-4 times and do this multiple times in a day. This way you will assist your eyelid movements. At the same time, you will maintain the muscle memory of how the blink has to happen. The second exercise that needs to be done is eyelid stretch. For this, lift your eyebrows and then pull your eyelids down. Hold for some time and release. These are the only two exercises that should be done every 2 hours. But please don't do any other facial exercises constantly, because facial muscles can easily get tired and fatigued because they are designed in that way. So, in summary, facial rehabilitation process is not a linear process. It needs to be strategically worked upon depending on your condition. Taking professional help is ideal because your face is priceless. It's your identity. But at the same time, your face is not the end of the world. So please don't get depressed or don't feel low just because you have suffered from this. There's always a hope if you work on the things in the right direction. I hope this video was helpful and informative for you. If yes, make sure to like this video, share this video with someone who is suffering from Bell's palsy or synkinesis, and don't forget to subscribe to HealthQ channel so that you can get notified every time we upload a new video. Thank you.